I wanted to thank you all for taking the time out of your weekend to come and join us as we try to do our midwinter here virtually. It is a new and a different and strange time, and we do appreciate you all accommodating us as we try to advance our organization this year, despite the limitations that the coronavirus has placed upon us. We do intend to be having our chapter leadership forum here shortly. We have an excellent speaker who will be talking to you about how you can be a better leader in your chapter, in your community. And that's what we strive to do. Our mission is obviously to better the lives of veterans throughout our country, and especially here in California. And in order to do that, we need the best leaders possible, and that is you. So if you don't have the experience, you don't think you can do it, I'm going to tell you that you are wrong. Anybody can be a leader. You just have to decide you want to, and then take the necessary steps to prepare yourself in order to be the member and the leader that we need you to be here in California. So I don't really have anything prepared right now, so I don't know how long it'll be until we have our speaker come on. But I do want to thank you all once again for coming on. We do have 50 or so people who are already logged in, and we hope we will get several more to come in. I am in sunny San Diego right now. It was raining all morning, but it's now cleared up. Hopefully that is a sign for how this meeting is going to go. Everything is going to be shiny and rosy, and we'll all be better for it. Once again, I'd like to thank Robert and Dan and the rest of our staff down in Santa Fe Springs, especially with the help of our new IT professional, Enrique. We have an amazing staff down there, and they have so far put on a flawless presentation. I would like to applaud them for all of their hard work and dedication in making this success. It has been no easy feat to get this thing up and running digitally from the format that we normally have presented to you. And I really do appreciate everything that they have done in order to make this thing work. So
I'm spotlight right now, Commander. Sorry to do that. And I'll tap dance. We do have JR coming on first, so we've got a difference in change in motion. We'll have the benefit protection team leader / legislative director come on first, and I see him on right now, JR. Once he gets his PowerPoint up, we're just going to spotlight him and make him the host. However, good morning, DAV California and guest. There's about 70. I see the numbers popping up right now, and we do thank you, just like the commander said. Thank you again for popping in for the second day and for the first virtual annual. Hopefully this doesn't continue to move on, but we're very grateful for each and every one of you, and we got a lot of great feedback yesterday for what was going on, and a lot of questions, right? So what we'll end up doing is we'll have a summary email sent out to everybody, especially regarding the CSO training and the documents that are coming with that, right? So if you haven't already got that email, look in your email boxes for files that we sent out last night that will help with this. JR, just give me a thumbs up when you're ready. And okay.
Yeah, just one real quick question on that, Robert. I don't know how many other people received an email this morning, but I received the email saying I was not attending. That you guys were apologizing for me not being able to attend the conference, and obviously I was here yesterday.
Well, I don't know anything about that. So, but we'll definitely iron that out. Again, are you ready to kick off, JR?
I am. You want me to just see share screen?
Here go ahead and share screen, and then it's all yours.
All right, awesome. Let me go ahead and get it started then. How's everybody doing?
Great.
Yay. All right. I am going to ask that if everybody can go on to mute, and then Robert, if they have questions, if you can direct the questions to me at that time. All right, everybody ready? If everybody could have their mic on mute, and then Robert, if you can go ahead and as they have questions, if you can direct their questions to me, that would be great. That way we can get through this as orderly as possible. Um, I hope everybody is doing awesome. I too am very excited and very pleased with the department that they've been able to pull this off. Although it is virtual and we are a department of huggy, feely kind of loving people, this does give us an opportunity to, at the very least, to be able to see each other and to touch bases with each other and share some different ideas. And legislatively, we have two areas that we work in. We work in the national legislative goals, and then we also work on our own state California goals. So right now we're going to talk primarily about our state goals and what our policies are going to be and what we want the resolutions to look like for the state benefits. And as we get the nationals new policy goals, we will be putting those out when the DAV national headquarters post their new policy goals. All right. So I want to thank Robert for putting this together for us. We gave him a little bit of information and then he ran with it and created an awesome slideshow for us. So I am your DAV California Legislative Director. I go by JR, not Gerald. If you call me Gerald, I won't answer. No, I will, but I will ask you to call me JR. The purpose of this is to include you, and that is the chapters in your community around those chapters in getting focused on what our legislative goals are for this year for the state of California. And we're going to cover that through you getting involved, the chapters, community level, the state level, the national, global level success. We need all of us to work together, but we also need to be all working on the same thing. What we do not need is individual chapters going out there and trying to do their own thing. Bring those ideas to us, and then we can get all of our chapters to work on that project. You understand how that works? That way we get success. It's not a Northern California and a Southern California thing. They all convene in Sacramento. Right. And right now, what we want to concentrate on is resolutions and legislation that deals with housing, health, employment, and education. Okay. And employment, also, we're including disabled veteran owned businesses. So the DVOBs, which have benefits as well. And then benefits for all veterans, and then women veterans, specifically for women veterans, and then veteran recognitions. And that could be, we have the veteran on our driver's license. However, we do have a fee that is associated with that, right? And then also there's some other things that we'll get into later on in this slideshow. So housing. What are we talking about when we talk about housing, and what do we want the resolutions to be guided in the direction of that? A big one is we want to reduce or eliminate property tax burdens for California service disabled veterans rated 100% permanent and total to include their surviving dependents. Currently, we have a partial exemption for the disabled veteran that's at 100%. The difference between this and that would be we're asking for either to greatly reduce that or to completely reduce or to eliminate it for those veterans that are rated permanent and total. And as you go through your chapter training, service officer training, you'll see that that's a different evaluation. Those are two different things. A veteran could be 100%, but still have future examinations. Therefore, they are not rated permanent and total. A veteran that is rated permanent and total will have on their rating decision the eligibility for dependent educational assistance, Chapter 35 benefits. The only way for a veteran to have the Chapter 35 benefits for their dependents is to be rated 100% permanent and total. And that could be a straight 100%, that could be individual unemployability. The important part of there is that it's permanent and total. And many of you have heard me talk about this before. Permanent means that there is no future examinations. Total means you're being compensated at the 100% rate, right? And that's the difference between the IU, right? You're being compensated at the 100% rate. Address the root causes of California's housing supply crisis, such as those that encourage construction. The more houses you have on the market, the more competition it is, right? The more expensive it is, the higher the rents, the more subsidies, all that stuff. We need to have houses being built in our state to increase that. To increase funding and for affordable housing that benefits veterans and their families. We want cities and counties to start helping us with this. I know in my own city, we have housing set up for veterans as well. We want more of that. We want to encourage the available affordable rental housing and create policies that lower rents, not raise rents, and then have us chase those high rents. You see that's kind of what happens. The rent gets high, and then we subsidize and keep on going and going higher and higher and higher. It does not do things to lower it. We want to have policies that create affordable rental housing for our veterans. And then enhance the use of, it says VAC vouchers, but I believe that's HUD vouchers there. Do we have any questions right now, Robert, in regards to housing or anything? Is Robert still on? All right, I will at this point in time, let you guys go off, put you guys off of mute. And if anybody has any questions on housing and any kind of resolution that we would be looking for to benefit veteran housing.
Currently there, Ralph De La Torre has asked, I've been rated at 100% final degree of disability. Will I be subjected to any further evaluations in the future? So sorry, I should have vetted that. And Ralph, we will get, if you can save that for the NSOs, because that is more of an appropriate conversation for that type.
Yeah. Robert, I can give a quick answer to that though. If they go back to their last rating decision, and that rating decision that awarded 100%, if it says you have eligibility to Chapter 35 benefits, then you are permanent total. If it does not say eligibility to Chapter 35 benefits, you are not permanent total. Okay. Any other questions on housing?
No, sir.
All right. We also want to have DAV California sports policies that prevent and facilitate the rehousing of homeless veterans into transitional and permanent supportive housing with wraparound supportive services. And what does that mean? That means not only are you going to be housing in them, but you're dealing with their health, their education, their employment. All four of those four pillars are important to that veteran, especially that homeless veteran, to get them that firm foundation so they can become servers again. We all served our country, right? We want our veterans to be able to serve their communities as well. And that is a great way to get somebody that is a homeless veteran back onto the path of service. Enhance access to health and mental health services for homeless veterans. That's part of that wraparound services again. You know, if we're going to, it's not just getting somebody and putting them in a hotel room and saying, hey, the public doesn't get to see them, so they're not there. We don't have a homeless problem. No, we actually need to take our veterans and get all of those services, especially the mental health services for our homeless veterans, and make that more available. Promote home ownership among veterans, including lending programs targeted to veteran and policies that increase the supply of housing. I think many of us have gone through the process of buying a house. We certainly want to make that more attractive when a veteran is buying a house for them to be able to get in there. It's housing. people. So we want to be able to get more veterans into our state. We want to get them into home ownership. We want them to be able to get off the streets and get those wraparound services that they need as well. Do not place unnecessary or costly burdens on property owners. In the state of California, we are talking about legislative stuff, right? So if it's harder for a person to rent their property, then that's decreasing the amount of available housing you have on the market, right? So we want mom and pops to be able, to be able to do this and not make it such a burden that they say, you know what, I'm not going to put the house on the market. I'm going to keep it up. All right. So we need to stop doing that kind of stuff. And then health, we have housing, health, education, employment. So this is health. The California DAV supports policies that prepare and supply better prepared healthcare providers for the unique challenges of veterans healthcare. Now we have the ability to go out into the community and get services, right? But we have to maintain, and this has always been one of the DAV's points, is that if we're going to open it up, then we have to maintain that quality of care or that continuum of care. The community has to be able to integrate into the VA for our veterans to be treated the same, to get that same quality of care. But then also medical records. The NSOs will tell you evidence, 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 right? But if we can't get the evidence or it can't be incorporated into the VA systems, then how can it be beneficial to a veteran? All right. Protect the VA's discounted drug pricing. Absolutely. Absolutely. If we're going to go to Walgreens and pick up our medication, then we should have the same deductibles and different things that veterans have at the VA healthcare when they receive their pharmaceuticals at that location. Again, if you're over 50%, then you do not have those deductibles. But those veterans, and we have many members that are lower than 50%, do have deductibles. So we want to make sure that if we're inviting our veterans into the community care, again, that they pay the same deductibles and they get the same quality of care. Expand telehealth services so that veterans in rural and underserved communities have greater access to care. This is a perfect example of it. The coronavirus came out, and then we had to turn to different technologies. Even though Zoom and Microsoft, all those things were around, it wasn't really commonplace as it is now, right? And that also goes with telehealth. So as many of us have been seeing our doctors, our psychiatrists through telehealth, that needs to be expanded. The bandwidth needs to be expanded. Veterans that cannot afford to have the ability to have telehealth need to be able to have that access as well. With telehealth, imagine this: if a female veteran wants to see a doctor, right? Maybe she has 2 kids. This gives her the option of being able to stay in a location and not have to travel, pay for daycare, different things like that. So there's a lot of opportunity with technology, and we definitely want to make sure that we utilize technology that gives us, the veteran, the most access to treatment, to healthcare, and different things like that. You could, many veterans also have diabetic devices, insulin devices in there that report to the doctor and different things like that. Blood pressure, for example. Focus on suicide prevention. Absolutely. Absolutely. And I don't want to beat a drum too many times, but we have to realize that it is, most of the veterans that are committing suicide are our age. I'm almost 50, but there's a lot of Vietnam vets that are in their 70s that are committing suicide as well. A lot of women veterans are committing suicide, and they're doing it with handguns now. All right. As we bring more women into combat situations and training and different things, like they become more familiar with handguns. So we have seen a rise in women veteran suicide by the use of handguns. And we also know that if you can get that veteran into treatment, that greatly reduces the
Do that,
suicide
man.
risk. To provide funding for research on veteran and service member mental health and traumatic brain injuries. It started, you can see how it ties into a lot of mental health, right?
Okay.
Because we do have a lot of mental health. Robert, do we have any questions? Let me see here. As the Women's Veteran Advisor and a member of the legislation team, I rarely have to leave the meeting. Oh, Penny, she's awesome. She's squared away. We talk on a regular basis, so I'm sure we'll talk about different things. Does anybody else have any questions about health? You can go ahead and take yourself off of mute and ask. Let me go ahead and I'll jump into the chat here and see if there's anything. Is it worse now? You know, that's a moving number. It's a floating number. So I can tell you that it's still around that number. Do I think it's 40? I don't think it's 40. But you know, that is way too much.
JR.
Yes.
JR, this is Commander McCary. How are you? Good morning.
I'm doing fine, Sherelle. How are you doing?
I'm fine. I got a question for all of you. How are we tackling the suicide rate, not only with our veterans and military, but we also have a lot of suicides amongst our community as far as our civilians are concerned too.
Sure, absolutely. Absolutely. I think the stigma of mental health conditions is starting to whittle away. I don't think that, back in the day, if you, especially, if you're macho, right? You can't be, you got to be macho, right? And that's for our female veterans too. They have when they're in the military, they got a lot, they have certain standard, things that they don't want to have those impressions. So I think a lot of those barriers are going to the wayside in the veterans community as well as the civilian side. You see more commercials, more things like that. And you're absolutely right. We have brothers and sisters that we love as well, and we don't want anything to happen to them.
And the reason why I bring that up, because I'm also a member of the AMVETS, and what I've been doing is that I've passed out over 400 bracelets or more of 22 per day. And a lot of my corporations like Stater Brothers and Home Depot and Lowe's, the managers are telling me that they have a lot of suicides that have been happening not only in our communities with civilians, but also in their families. And they were obliged to take those bracelets and pass them out, not only to all their employees, but to all the customers that come in these places, and to make them aware. Because my thing is, I want to make sure everybody across the whole United States is aware of the suicide rate and people that we're losing, because that is so permanent. Once you take a life, once a life is taken, that there is no getting that life back.
Right. We don't have a time machine. Dr. Dan Helix, do you have a comment that you'd like to add on that? Dan Helix, can you take yourself off of mute? Dan, I know you're on because you were just texting me. But anyway, all right, we'll get back to that. Is there any other concerns or questions about health, veterans health, the veteran suicide? And remember, guys, what we're asking you to do is to take this and utilize this for your resolutions. Without our chapters writing resolutions, the legislative team, we can't go to Sacramento, right? We have to, it's in our bylaws. We advocate what our resolutions. So the resolutions give us that ability to go do that. And these are the, again, health, education and employment, and housing. And we get into the other ones, but those are four real main areas that cover a large part of the veteran's life. Okay, housing, education, health, and employment cover a large spectrum of things. All right, employment and education. We support policies that programs or initiatives that better prepare service members transitioning out of the military and into civilian careers. These may include expanding the TAP program, establishing programs to provide skill training, employment resources, networking opportunities, helmets to hard hats, construction apprenticeship programs, establishing consistent policies at California Institution of Higher Education regarding receiving course credits for military experience. That's a big one too, right? Improving or expanding GI benefits for veterans and their dependents. Education, man, if they have the proper education, then employment is a little bit easier, right? So it's part of it. That's kind of where education, employment start to fit together. You see that. Policies that allow the dependent of an active duty to maintain certification they may have obtained at their prior duty assignment. This is one that's been around there for a while. So if I'm in Texas and my wife is a chiropractor, for example, and she is a civilian, and then I get redeployed out to California, my wife should be able to carry those certifications and have the opportunity to be able to have employment in the state of California as well. And then we also want to talk about the disabled veteran-owned businesses. Many of us out there know of a disabled veteran-owned business. I myself, with the other things that I do and my vendors, I specifically look for vendors that are veterans. And then if they're a disabled veteran, I go right into the whole DAV spiel, right? But we want those, the DVO, the disabled veteran-owned businesses to be able to expand the benefits that they do get. There is a benefit for them for the bidding process, right? If they have, government contracts and different things like that. But there's ways that we can expand that out. Instead of 1 day, go for 2 days. The price of license and different things, and having counties waive fees for business licenses and stuff like that. So we really want to be able to cover those. And again, it starts with you guys at the chapter level coming up with resolutions and then bringing those resolutions to our convention, and that's where we vote on those resolutions. But we have to have the resolutions to be able to do that. Does anybody have anything they want to talk about as far as
JR, can you see the Q&A box, JR?
Yeah, let's see right here. All right. Yes, can you elaborate for viewers that CalVet is doing such as its webinar program series to tackle the issues you raised in your presentation? Absolutely. Richard Valdez, we want to elaborate. CalVet is doing such. We're not CalVet, but we have some of the same goals as that as well. And we also join forces with CalVet on many issues that deal with our disabled veteran population as well. And many of our policies and their policies match. And that's kind of what we want to do across the state, right? Not only do we want CalVet, not only do we want AMVETS and VFW and DAV, we want them all working together to serve our veteran population. What we at DAV do not want to do, however, is chase another organization. We want to support them when we can support them and ask for their support when they can support us as well. But yes, many of our policies and their policies, and that's a good thing. That is a good thing, right? They match. And we want the other service organizations to also start matching some of our policies. Obviously, the VFW has somewhat of a different mission than the DAV, but there's many areas that we can do. And then Ernest Ziegler, is there a current legislative advocacy program at the state? I'm assuming that means for the DAV at our state level. And my short answer is that's exactly what we're trying to do right now. And Richard Valdez did a great job of that as well. And now we're going to expand onto that as well and really bring you guys in there. And we really need those resolutions. Promoting the resolutions passed at our last state convention. Those are good things. We have resolutions. Sometimes they don't get covered or tackled or to our satisfaction, right, in that legislative cycle. But as Richard Valdez will let you know as well, we are in a new cycle, a new legislative cycle. So we want to have those resolutions generated again so we can tackle those in the new legislative. Every 2 years we have a cycle, right? We want to be able to do that. Old Adobe Chapter 117, we hold Zoom meetings. Just keep an eye on our chapter members, making sure that they have a place to talk, bring up issues that they may have. We talk about suicide. For the most part, the same people that came for the meeting before COVID are the same people that joined the Zoom. Absolutely. I think that's absolutely awesome. And that's exactly what you want to do. You want to be able to have those Zoom meetings, and because that's part of health, right? That's part of our health checks, our health and welfare checks. So thank you for doing that. Absolutely. And I think, Dan put it very well yesterday. There's a lot of things that we can do over Zoom. There's some limitations, but it's, if you're not having a chapter meeting over Zoom or Microsoft Teams, you really need to do that. And you're absolutely right. It does. You do that for those health and welfare as well. All right. Are there any other questions that I did not see? I kind of went through the questions and answers there, Robert. We also want to reach out. One of the things that we did a couple of years ago up here in Northern California is we tied into the into the apprenticeship programs out here, and we did information seminars / job fairs, and we invited the apprenticeship programs out there. So we had the NSO offices out there doing their information seminar, and then after that we had the organizations tabling for a job fair. So there's many ways that we can tie into them as a chapter as well. All right, and then utilize our NSOs. And of course, in a perfect world, it's pre-COVID-19, right? But there are virtual health fairs and there are virtual information seminars. So we can do it. Benefits, policies that support improvement in veterans claims engagement. What is that? What exactly does that mean? We want it to be, when veterans come in or get out of the service, we want them to have that main highway, that humongous highway, right to the veteran service organizations or to somebody in the community that would be able to assist them in their claim. When a veteran files a claim, they're 10 times more likely to also go out and get health care from the VA as well. So we want to be able to make it as easy as possible to improve that claims engagement. Policies and initiatives that help educate veterans about the benefits they are entitled to receive and support that exists to help them. That's basically this. It's kind of the same thing, right? Access to benefit claim services. That's us. We are the primary, the best service organization out there when it comes to claims work. I don't think any other organization will argue with that. The NSOs get the most training. Later on today, we do the chapter service officer training. That is very intensive. And so I'm not biased when I say the DAV is the best veteran service organization. It's just a fact. It's just fact. All right. Legislation that would create a governor's memorial certificate similar to the presidential memorial certificate, which is a signed certificate by the president. Why? I mean, doesn't that make sense? When a veteran dies, we get a presidential memorial certificate. Simple thing. We just want to be able to have one from the governor. And if you don't like the governor, then don't get it. Just tell your family, I don't want one from this governor. Wait till the next governor. I don't care. Women veterans, and I am going to look for Sherelle to jump in here for a little bit at the end here, and any other woman veteran that we have online, because it is imperative that we hear from you. You have a voice in our organization. Men have ears, believe it or not. Believe it or not, we can listen, and we should listen. We should listen to our women veterans. Just as I mean, there are our sisters, our mothers, our aunts, our daughters. We love them. They serve right along with us. Currently, women constitute 50% of the active duty military and 18% of the National Guard and Reserve. And it is projected that 10% of veterans are women. California alone is home to about 145,000 women who served our nation. Despite women's increased presence in the military, there are still many barriers to accessing health care and other earned benefits. So let's hear from our ladies.
JR.
Yes.
The barriers that they're talking about when a lot of my sister vets, now I'll go into the VA hospital and I just sit there and I watch how a lot of my sister vets get treated. And a lot of people who are in the VA system, that work in the VA system, a lot of times they will expect a man to be standing by her side, and they'll ask, well, where is the veteran at? And they will totally ignore my sister. And I'm like, okay, she served just like her spouse or her significant other. Yeah. And we are still having that problem to this day of being recognized for all the stuff that our women have done. And women have been served in the military as far back as I can remember.
Yep. Absolutely.
And don't get me wrong, because I'm not trying to take nothing away from my brothers, because I love you guys with all my heart. And there's nothing that I would not do for any of my brothers. I love you all. But the fact remains, we serve by you all side. And we stood in that combat field too. Right. And we sacrificed just as much as any of our brothers. And a lot of my sister vets also have been wounded in some kind of way. Mortally wounded. They have lost their lives. A lot of my nurses out there lost their lives on that battlefield as well.
All right. Absolutely. Yes, I got the text, Robert. You want to go ahead?
No. There's also and Enrique, if you could highlight Linda Butler. She's had her hand up. She's got a question.
Okay.
Linda Butler.
You want to move on to Michelle, Charity Michelle Julian? She said she'd like to speak. Michelle, would you like to speak? Laura Lewis has a question. What if they were dishonorable discharged? Well, my question there, Laura, would that be, are we talking about, I guess we're not really talking about medical there. Then we want to have a discharge upgrade, right? Especially, a lot of women were put out and there was an MST involved, right? So when we get women that have dishonorable discharged, we certainly want to ask, what were some of the circumstances, but we do want to get them on the path to be able to upgrade their discharge, because treatment, a lot of VA benefits will be barred because of the dishonorable discharge. Okay. Michelle,
JR?
yes.
JR, this is Nancy. Can I speak to that?
Yeah, absolutely you can. Yeah, sure.
Thank you. So DAV has a partnership with a legal organization called the Veterans Consortium.
Mhm.
They offer free legal counsel and guidance to veterans specifically about discharge upgrades. And we all know there are several different elements that affect a veteran's discharge, character of discharge. There's a great focus on post-traumatic stress and including MST. So every discharge is different. Every situation is different. Nothing is cookie cutter, but the beautiful thing is that this partnership allows professional legal counsel to those veterans to help them create the strongest case possible to upgrade their discharge. So those resources are available. Your national service officers have that information available. So we never turn away veterans, regardless as far as service goes and benefits. We always try to help them get the maximum benefits they've earned. Sometimes we have to fight for that with those discharges. Sometimes we can and sometimes we can't, but we have the resources available to fight.
Yes, thank you, Nancy. Back in the day, NSOs, we would actually represent veterans on discharge upgrades. Back in the day, we used to do that. But you're absolutely right. We have that for the national partnership, which is absolutely wonderful. And then in your community, you may also have other services. Here in the Bay Area, we have Bay Area Legal that does discharge upgrades, and we also have Swords to Plowshares that does discharge upgrades. Michelle, did you get your mic squared away? Did you want to say something?
Yeah, can you hear me now?
Yes, absolutely.
Yeah, I didn't have access to any of that. Thank you for giving me access. I wanted to say one of the reasons why I, except for right now, always wear my DAV cap when we're doing midwinter conferences and national conferences is because a lot of times I get asked, oh, so what position are you in an auxiliary? And even sometimes when I wear my DAV cap, I get asked that. And I think that like with the VA, they'd be like, are you the veteran? And so finally I told them, I said, look, why do you even have to ask if you're the veteran? If the person's walking up and they give you your last name and the last of your social, then pull it up. And if the gender doesn't match, then, you can take that chance and ask, are you the veteran? But usually you could see right there. But another thing, I think that the VA has done a great job and the DAV has done a great job incorporating females and trying to give us equity. But I still come into problems with the VA, and I'm sure some of our male veterans have this issue too. As single parents, there are times that we cannot get babysitters. And so we have to bring in our teenage kid. Yep. Or like me, I have one with mental health issues. And the ACC is supposed to be a regular doctor's office. It's not a hospital. And I understand COVID is extreme circumstances, and I wouldn't bring my child unless I absolutely had to. And I got turned away. I got turned away because I couldn't bring her in to do my labs and my ultrasound. So I think that even though the VA and the DAV has made great steps in taking care of and trying to make females equitable and younger veterans equitable with the status and the acceptance, I think we still have some areas that we could definitely improve on or create an area to not create, but find areas in which we can help, like transgender veterans or veterans that are not homosexual veterans, okay? Ones that don't identify with the regular norm, to bring them in and incorporate them. When I was in, I'll just make this short and then I'll be done. When I was in the Army, we had a soldier in another section always came in for KP, always, because he just didn't fit our mentality as a soldier. He was a good soldier, but he was different. And we all know that we all have friends that are different. And so talking with him as veterans, if we cooks hadn't have brought him in and accepted him in, where would he have found acceptance? Where would he have found that support? And coming to know him more, he really did need that support mental health wise. And so if we can open our minds and hearts to people who have different lifestyles or different beliefs and different religions, we could reduce some of the suicide rates or the mental health issues that occur from the isolation. And our veterans, we're not, even when there was Don't Ask, Don't Tell, not all of the soldiers or Marines or sailors were straight, and they still aren't. They just were hidden. And why would we continue to hide them now? So I know that for some of us, some of us, we all have different beliefs in the DAV. We come from different backgrounds, and we should be inclusive and support our fellow veterans and find ways and different programs to support them. So I really want to thank the DAV. It has done tremendous help for me, and I hope that we continue to grow and not only help the female veterans, but those who are on our outliers, that we haven't become a complete whole with us.
Absolutely. Absolutely. Thank you very much, Michelle. You're absolutely nailed it. All right. I also want to put out, and I want to thank whoever put up on the chat, but there is a 1-855, if you're a woman or a man and you want to write this number down, this is the Women Veterans Call Center. And the number is 1-855-829-6636. And that's 1-855 VA Women. All right. So 1-855-829-6636. And the Women Veterans Call Center is staffed and trained to provide women veterans, their families, and caregivers about VA services and resources. They are ready to respond to your concerns. The call is free, and you can call as oftentimes as you like. All right.
JR, I'd like to drop in real quick. For everyone listening to this right now, JR is bringing attention to what California needs its chapters to write resolutions on. So to kind of reiterate what's going on, he's not just presenting, some stuff. These are issues that have been vetted out through chapter leaders, national leaders, right? Both departments. But Michelle comes on and brings up something, and in her conversation, this is what we need to do collectively. We need to hear the conversation and get between all of what's being said and say, okay, there's the problem we need to fix. There's a problem we need to fix. There's a problem we need to fix. For instance, if you were listening to Michelle and you heard, hey, some of us mothers go to work and there is no healthcare, right? There's a problem we need to fix. Those are the resolutions that JR is saying, okay, well, here's a women's vet. I'm bringing this bullet point. Michelle says, here's also problems that we're facing. And so that's when the chapters come together and say, okay, we have a member, she's been having a hard time as a vet trying to get healthcare or childcare at work and this, that, and the other. Let's try to write a resolution. Who knows where it's going to go, right? Who knows where it's going to go? And so I'll end on that. JR also, JR can talk about real quick. We had a couple meetings where we meet on Zoom individually, some veterans with specific issues, and they want to talk it out. How do we solve this, right? And then, JR got a collective of big brains together and say, okay, this is how we can support, but you need to do XYZ. So there's JR can see the Q&A. If you've got any Q&A or questions, I would suggest that you write them in right now, and he'll answer those. And then we're going to segue into the second leadership portion of the virus or the vaccine. But here again, what are the problems that we're hearing under all of the layers of the storytelling? And then how can we as chapter leaders or just leaders in our community go ahead, write the resolutions, bring them to the convention? And please, JR, before you get off, can you please reiterate how the legislation process works, that we can't just make resolutions pass unless they're voted on. So I'll step back off right now, and then when you're ready to segue, it's your show.
No, absolutely. And I'll wrap it up very quickly, but it is really that grassroots legislation. That's what we do. So at the chapter level, you guys do your resolutions, and then we go to the state convention and we pass. That gives the legislative team the right to argue on behalf of or advocate on behalf of the department for our goals. All right. If the legislative team does not have resolutions to back them up, then we cannot support or advocate for something. Right. And so that's the reason why we kind of wanted to expand it, make it broad, but also then give you guys lanes in each one of those highways. So if you get on the highway of health, there's many different lanes on that highway. The only thing that we do not want to happen is for you to get off the exit and go down some little dirt road, right? We all want to be together. So that gives us the ability to advocate and then go to the state on the state level and advocate for those law changes there. But then at a national level, it's the same thing. They need resolutions, and instead of from chapters, they need resolutions from states, right? So national can't advocate unless they have a resolution that's backing and supporting that issue as well. So it truly does start down at the chapter level and start with that resolution. Okay, and if you submit a resolution that just doesn't fit our privy, then we'll look at that and we'll contact you again and explain how it doesn't fit into that privy. Okay, and then give you the opportunity to adjust it. But when it gets to our state convention, our state resolutions and our national resolutions have to be set and voted on very well. And if you have any other questions, you can always contact me by email at bptl@davcal.org. That's the Benefit Protection Team Leader, bptl@davcal.org. Or this is important, text me. You can text me. Okay. I don't mean to be like, oh, he's so rude, whatever. It just, if the phone rings and I don't know your number, 9 out of 10 times I'm not going to answer it. All right. So if you text me, obviously I'm going to know who you are. I program the number into my phone, and then we don't have any issues. If you don't like texting, then email me. It's bptl@davcal.org. And we also have other resources. Richard Valdez did this for a long time. Great guy, valuable experience. Okay. So you have leaders within the state that can certainly help you. The only thing I ask as the Benefit Protection Team Leader is that we stay within our highways and we don't deviate off to dirt roads, go down bunny holes that we're not going to get anything at. All right. So Robert, I think that's about it. I think we answered a lot of different questions. I want to thank everybody for their questions and their concerns. I want to be able to work with all of you. And we want to have really good, strong resolutions. Again, four of the main areas are the housing, education, health, and employment. All right. We also want to support our women veterans. We also want other benefits and stuff like that. But if we really concentrate on those areas, and again, the other organizations, we're getting them to be focusing on those same areas as well. They may have another lane on the highway, but they're going to be on our highway. Okay. With all that, I love you guys very much. And Robert, I give it back to you.
All right. So thank you, JR. Over the past couple of years, JR and I really bonded, and I trust that JR has this department's best interests in heart. So by all means, do not be shy. Don't hesitate. Email him, text him. If there are any questions that, if you see, and as small as, hey, these sidewalks don't have any way for anybody with wheelchairs to get on them. As small as that to as large as, cancer victims with who have to have special needs if they have cancer in their throat. They're not getting the work done or the food that they need, the nutrition that they need from the VA. So, that's a large issue that takes resolutions to go process. Right now, we're going to segue right into Mark Berner from VA McLennan. He's the patient advocate, and he's going to share with us, and you can spotlight him as well. He's going to share with us information about the COVID-19 vaccine in the VA specifically, and how it relates to us and our community. And he's also willing to answer questions. So please type in any questions into the chat or the Q&A, and we'll send them up his way, and he'll try to smooth out this this topic. So thank you, Mark, for joining us on a Saturday morning, and the floor is yours, sir.
Morning. We are currently, we didn't have any appointments this last week because we ran out of the Moderna virus, the vaccine. What we've done is we now have the other virus, and they have 400 patients set today at the satellite clinic, McClellan itself. They're trying to show that they can do, they've got all the nurses on hand. All will be screened for 15 to 20 minutes after each shot. They can do drive up, or they can do walk in with the vaccine, but they all have to wait for 15, 20 minutes to be released after the shot. They were only doing 75 and above until yesterday. They lowered it to 70. Unless you have extenuating circumstances like diabetes or something else that was needed, you would just state your case, and your primary care provider could ask for the shot and you could get it. They were just making regular appointments for the majority until we ran out, but we're back in stock and everyone's going on. Okay. Any questions? So I don't see anything. I do see the chat, but there's nothing on the chat.
No, I don't see anything, sir.
Okay. They, each satellite, they are all, even though we have satellites here in Northern Cal, there's actually, for Northern Cal, there's 8 satellite clinics. They will all have the virus, vaccine just as available as the main clinic as Mather or Martinez. People were driving in and from different areas, even Reno, a couple people couldn't get in and they drove down, and they will not turn people away at the main hospital. The shot, again, is only good. The vaccine is only good for a certain amount of time. So if you don't show up for the time limit for your shot, they're going to give it to someone else because they're not going to waste it. We did have one patient who was very upset. He came at the end of the day. They were taking people in line, although he had an appointment. He was an hour late. He was the last person, but the person before him got the last shot. He was unhappy because they didn't want the vaccine to go bad. So again, they set out so much each day, and they put a little bit extra for people walk-ups. The side effects, I see that. Okay, so someone did have the anaphylactic shock problem in California. So they pulled all the Moderna, and they came back out with that again yesterday in the national news, saying that 1 out of every 100,000 is going to have that problem. So, but they did release the Moderna again. The Moderna is the one that has the longer period between the 2 shots. And that's the one I've actually had COVID, and I, was quarantined 14 days. Didn't hit me very hard. And I've also, then when I got my first shot, because of that, for the antibodies, it gave me COVID again for 2 days. So you're going to hear a lot of people say about the first shot, they just had a sore arm, but they'll get the second shot and they feel horrible. We had a couple of nurses this last week, 3 of them got the first shot together, and then they came and got the second shot together 2 days ago. And both of them, all 3 of them felt horrible. Your arm aches. I don't know if many of you have been given the shingle shot, but you feel just as bad in the arm with the shingle shot as the Moderna virus. And, but the second shot, you will know it because your body was fighting it from the first shot. Let's see, one of the things we've been telling a lot of veterans that they're done here in California is Roseville, Placer County is giving shots to people who drive up there. Let's see, I'm seeing these now. The shots are given at each clinic. And like I said, they're doing even drive-ups and they're doing inside appointments. The nature of the side effects are you feel like you have COVID. When I got my second shot, I had a slight fever that night. I had the shakes, which I did the first when I had COVID. And your body thinks that you have it, but usually with the shot, it goes away within 2 days. As far as the annual shot, they don't know. They haven't told anyone if the shot's going to be annual or if it's good for anything. They just keep saying they don't know. So you're telling me a 74-year-old diabetic can call their doctor to come in and get the COVID shot. Yes, the doctor can say this person's a high risk, and they can make an appointment for them. Okay, blood donors. Once I had the COVID, the VA asked me to come in and get tested for antibodies, and I did have antibodies. So of course, then they were asking me to donate blood because that is the ultimate for helping saving people's lives is the antibodies in the blood. Again, I can donate blood. They were asking me several times. Yes, I was sick after my second shot. That night, I vibrated all around the house with a fever. But it went away after that night. And they do tell you that if you do have them, take Tylenol, Aleve, whatever, and it will pass on the second shot. Is it available standard across the state? I can only talk about our Veterans Health Administration here in Northern California. But I have talked to the San Francisco, and they sound very much the same.
I have a question for you, dear.
Yes.
What if you are alert? What if you have an allergy to Tylenol and over-the-counter stuff? Then what's the next best thing?
That I can't say. I'm not a pharmacist, but I do know that the symptoms, you don't have the disease because it's inert. It's just your body's thinking it has, because your body's going to fight the virus, the vaccine that was given you.
Mm-hmm.
But it did. As my wife can testify, that night, I said, wow, I feel like I have COVID again.
Mm-hmm.
But and that was on my first shot. My
Right.
second shot will be set up on the 2nd of February because it's 30 days apart on the Moderna.
Okay.
So And that's only because I asked the doctor, why do you think I had that? And they said it was because I'd already had COVID and I had the antibodies.
Ah,
So that's why they're going to tell you your first shot, you're going to feel fine. Everyone I know, they got their first shot and they were fine. But when they get their second shot, that's when it hits them.
okay. I was just wondering because I do have allergies real bad. So I'm gonna ask my doctor if I'm a good candidate for this COVID shot because my body reacts and I do have allergies extremely bad.
Yeah. Well, make sure you sit there for a good 20 minutes after you get the shot too, just to make sure nothing happens to you. So
Okay. Thank you, sir.
if I get both shots after the second shot and I get COVID, do I have to quarantine? If you get COVID, they're making you quarantine no matter what. When I got it, I was followed by the VA and the county for the state. So they both called me minimum of 3 times during the 10 days to make sure I was still at home, how it was happening, and if I had contact with other people. You do not have to rely on the VA. You can get, yeah, you're right. You can get the vaccine at the local hospital or walk in. I heard this morning that CDC is trying to set up to where they can give the vaccines because California is the lowest on getting the rollout of the vaccine. So they're looking at more ways to do it, but they do have it at the county. They have it down at Cal Expo too, giving shots. No, you do not have to have insurance and it does not cost you anything. They're not charging anything anywhere for the vaccine that I know of. Anything else? Make sure that if you feel you're at risk and you need it, get a hold of your primary care doctor. If you cannot get your primary care doctor's attention, that's what I'm here for, and all the other patient advocates. Call, let us know. We will help get to it. Let's see. I'm trying to read the long text they have here.
That's for resolutions, Mark. Don't worry about it.
Okay, not a problem. All right, so yeah, literally, I'm not sure how many of you know Diana Seamack. She is my go-to person for DAV, but I can be her go-to person when she needs something at the VA. You need to create a bond with a patient advocate at a site with you. They're always willing to help DAV. Make sure you get their number. I have her number. She has mine. She can call me anytime. We work well together. It really will. It's a good asset to have. Okay. Anything else? Okay. I have a little card. Let me see. All right. Here is my card. When you get the vaccine, you're given this card. It shows the date that you had it, and it shows when your next appointment for the second one is. So that card you can carry around. I was kind of hoping, because I've had 2 trips to Hawaii canceled, once we had our card and we wouldn't have to quarantine there. But a lot of states are still, they're up in the air, so they aren't letting people go around. But again, you get this card and it shows the dates you had it. I've got my first one in there. When I get the second one, it'll be all set. Okay, let's see. That they might make shots do shorter supply. Is the VA following this practice? Right now, we're not mixing shots because we had shots. If you had the first one, Moderna, we've had the shot for the second one.
Yeah.
So if we're making sure we're not having to mix it, we're all set. Okay.
Okay. So to our guest, well, Mark, thanks for all the information. And we're going to ask you to stay on for probably another 15 minutes and if you can bring up JR as well. And between the two, for everybody that's joining us today, between Mark and his information with the virus and vaccine, and then JR with with his information on the rest. Did JR bounce?
Pardon?
I also don't see him. Okay, well, JR's not on. So, if there are any, Mark, and this is for you, Mark, if there are any questions that come up, would you mind if our members reach out to you via email or whatnot?
Yeah.
Ask questions?
So most of the time, like you guys, the VA email is our first name, MARC, and period. And then my last name, it's Berner, BERNER, B like boy, ERNER, at va.gov. Reach out, not a problem. And I see a thing says Travis Air Force Clinic have shots. I know that our clinic does, but I don't know about the David Grant, who's right there, the active duty people. But our clinic does have the shots. Okay. So my address is mark.berner at va.gov. Reach out to me. Yes, that's what we're here for.
Travis has the shots, but it's only given to people that are 75 and above.
Yeah. Well, they lowered that just yesterday to 70. So, I'm sure that you're going to see a flood of people. The majority of our veterans anyway are of the elderly. So, they lowered it to 70 yesterday.
There's a question. CDC just put out not to have the flu shot at the same time or very near the time you get the COVID-19 shot. Can you give insight on that?
In fact, yes, that's right. You do not want to have any shot within 14 days of getting your COVID shot. And you don't want to have any of those shots within 14 days of getting your COVID shot. So you don't have any in between. I actually was under that same thing. They tried to give me my second shingle shot. And I said, no, I can't, because I don't want it to mess up between my 2 Moderna shots. So I will have it 20 days after my second COVID shot. Do not mix within 2 weeks any of your vaccine shots, okay?
Okay, so that's Fred. Fred, go ahead and unmute.
Yes, sir.
Go for it, sir. Floor is yours.
I didn't have a question. It's just popped up and I didn't touch a thing. I'm just sitting there watching. Sorry about that.
No worries. Mark, do you know if, and they say it's a sidebar question, do you know if all of the volunteer services are giving shots to the volunteers? And I already said it's VA dependent, but what about up there in Northern California?
Not all volunteers are getting it. They're asked, I know they're watching, and that's one of the things for a while there, they were letting the volunteers at Mather or even McClellan, because some people weren't taking it serious and coming in for their shots. So when it got to the end of the day, they would take the frontline staff or volunteers and say, hey, look, we don't want these vaccines to go bad. Come get a shot. I hate to see this stuff wasted, but that does happen. But again, if you fit in the criteria, they wanted to treat everyone the same. And so even if you're a volunteer, unless you're at risk, and then again, talk to your primary care doctor.
I think
now, the VA will not give one shot to any VA dependent. We get that question a lot. The guy says, oh, but my wife, she's 78. She needs it too. We give them I've printed up a map and given them a diagram to Placer County to where they can go for the county and take their wife and get the shot the same day. And I've had several veterans be very happy, come back and say, yeah, thanks, I got my wife a shot there. So, and they're not charging for it.
Okay. Phil Graff asked, how safe is the vaccine, which I've heard is not actually a vaccine per the company's own statements. And I know, and just a little story of my own, right? My wife is pregnant. And so I just had a conversation with her doctor because her doctor said, Dad should get the vaccine. And my question was, well, if I get the vaccine, can I still spread the vaccine? And so those two questions kind of coincide for me, because this is brand new. And I think you mentioned it, the RNA science behind this vaccine is the new portion of the vaccine, and that's what everybody's like, oh, what's going on, right? So the RNA, it's not that it's not a vaccine, right? It's not that this vaccine is not a vaccine, it's just a new standard of how we're creating vaccines, correct?
Right. We're not using the COVID problem itself, inflicting it to an egg or something, letting it cultivate and come out and then giving it, it's inert and giving it. This is the new way of doing it. And if this really works, it will really revolutionize all the vaccines. You'll see a lot of things a lot better. And I know your wife was voting yes. You might spread it to her, so you need to quarantine for 3 months.
Yeah, I heard that if you get it, well, I was told if I get it, I mean, if I get the vaccine, I can still carry the vaccine and pass it
You
on.
can still carry the
Or not
virus.
vaccine,
That's the
virus.
whole thing.
Yeah.
Your body, that's what people don't realize, that you can still carry a virus, because that's why they say wash your hands, wear a mask, do all this stuff. That's why the doctors dress up, and when they get done working with something, they take all the garb off, discard it. So if there are any germs and stuff on it, they don't carry it home and stuff.
Michael Spiro asks, Mark, where can we get a list of places to go locally?
I know it's on the California website. So the .ca.gov, put in vaccines.ca.gov, and I'm pretty sure you can do that. I try to stay up on that, but usually I'm so busy talking to patients during the day. But you can check, and they have it on the radio stations too, where people are giving them.
Okay. And I believe you answered this, but they've come up again. When is it going to be available to veterans under 65?
Well, again, it depends on if we have the shots, because right now they're not getting the shots out. They're trying to, meaning they haven't distributed. There might be a boatload of them out there, but they're not distributing it right now.
Okay. Well, I don't see any more questions coming up, Mark, and I do, and I hope I speak for everybody. I appreciate your time.
Not a problem.
And the information you brought to us. I'm sure that at least half of the individuals are more educated on the process than they were about an hour ago. So again, if any of you have questions for Mark or about the vaccine in general, Mark is the patient advocate for VA McClellan. That means that all of your patient advocates at any of your VAs will be able to help in the process of answering the questions that you need, specifically for your community, right? So where can we find something locally? A patient advocate near your community might have a better answer. And so again, it's Mark.Berner, that's BERNER @va.gov.
Yeah, they had it in the chat bar. It was correct in the chat bar.
Okay, and if you need that later on after this, let me know. But right now it's about 10:20. Our first break is supposed to start at 11, and chapter service officer training will kick off at 12. So if there's no other questions, we don't have our benefits protection team leader with us currently. So if there's no other questions for Mark, we're going to go ahead and take an early break and then kick back at 1200, and our SEC meeting will kick off at 1500. So utilize the same links that you use to get here right now to engage later. Let's see, before you move on, Mark, it says, let's be clear, the vaccine isn't a cure like receiving polio, chickenpox, or measles. It's more like in line with the flu shot. And will this be an annual shot?
The government hasn't told us that yet. We don't know. They're saying it could mutate. They've already said it has some, but it could be something to where they give boosters each year. Yes, just like the vaccine, the flu vaccine. So, and I see Robert, though, he said they're giving it 65 and older. I know that it's dropping all the time. I believe that depends on how many shots you have. versus the people we have, because we had, I think it was 8,000 more people added once they dropped it from 70 to 65. So, you know, we have to make sure we have the shots before we drop the age.
And for everybody still asking where or can the site be mentioned again, Mark did say you can find more information on the ca.gov website, right? Search vaccines for ca.gov. So California, right? ca.gov.
You can put COVID vaccine at ca.gov and it'll pop up. It'll show you.
All right. So thanks again, Mark. I appreciate you. Thank you, Diana, for introducing me to Mark and getting him on today. So everybody kick off until 1200 if you're going to be back for the CSO training, and then 1500, 3 o'clock if you're coming back for SEC. So other than that, we're signing off.
Bye.